good morning or good afternoon, everyone, depending on where you are. This is Joy Burkhardt with 2020 Mom. We're so thrilled to have all of you here for the first in our series of 6 Innovation Award webinars. 2020 Mom has received funding from the Zoma Foundation for a 3-year series of Innovation Awards, and are thrilled to be in our 2nd year presenting our award winners, starting with the Alachua County Perinatal Mental Health Coalition Florida Families First Act presentation. I'm going to go ahead and advance to the next slide, and we'll do some introductions here in just a moment. But first, we wanted to start with a little bit of housekeeping background. There are several of you on the line right now, and we wanted to just quickly say hello. We're interested in having you use the chat feature in your GoToWebinar control panel. You can open up that box. It's at the bottom of the control panel, a gray bar that says chat. We'd love to hear where you're from, and if you are a survivor of maternal mental health disorders, you are what you would consider an advocate, which is why you're here, to effectuate change. Are you a clinician? Give us a little bit of information about you. And again, you should be able to use that chat feature. There's also a question feature. You're welcome to use either one of those, and we'll be able to hear a little bit about you. So we'd love to, again, open it up to all of you quickly to do a quick introduction. Let us know if you are a survivor, provider, and do you consider yourself an advocate. So Rebecca, Shayna, Tracy, Myrna, Lindsay, Joan, Don, Dana, welcome everyone. We'd love to hear a little bit more about you. Let me see if we've got any feedback yet in the chat or in the question box. Great. Hi, Shayna. Shayna's an intern. Thanks for being with us, Shayna. Let us know where you are interning. We're curious to get some insight there. Let's see, we have a NICU social worker from from Tempe, Arizona. Thank you so much. We're glad you're with us. All right, and it looks like we've got another NICU employee. Thank you. Anyone else want to use the question feature and let us know who you are? Oh, someone from Lee County, Florida. Lauren. Great, and interested in learning about what's happening in Florida, and then also what she might be able to do in her own county. That's great, and also survivor. Thank you so much. All right, go ahead and use that question feature and let us know who you are. All right, we have a behavioral health specialist who works at the Inland Empire Health Plan, a health insurer here in California. Welcome. So glad to have you. Someone's working on opioid use disorders. Great, excellent. Well, thank you so much for those of you that introduced yourselves. A couple others from Florida, Lauren from Miami. Thank you. We've got someone on from Virginia. Hi, Elle from DC. We're so glad you're with us, an occupational therapy student who's doing some great advocacy work with 2020 Mom. Excellent. So feel free to continue to share information if you'd like to. Otherwise, we're gonna keep going here. And we have a range of providers. And what we've normally what we find in this network is that there's a lot of providers with personal experience, and it does seem to be that that's the case with many of you on the line today. That you wear 2 hats and are really interested in becoming an advocate and effectuating change. Great. Hi, Joan from Michigan. Thanks for being on. All right, and Myrtle Beach, South Carolina, a midwife. Fantastic. We're so glad you're with us. All right, well, we're going to go ahead and move on to introductions. I can't wait to introduce my friend, Lauren, who is the winner of the, I should say, honorable mention winner of the Advocacy Award within the Innovation Awards in Maternal Mental Health. Lauren DePaola, I hope I got that right. Lauren is an LCSW and has been leading this change in her county and statewide. I'm going to actually turn it over to my colleague, Brooke, who's on the line, also a team member with 2020 Mom, to read Lauren's bio for us. So, Brooke.
Okay, great. Thank you, Joy, and thank you, Lauren. Excited for the conversation today. So, Lauren DePaola, licensed social worker, is the founder and CEO of Better Beginnings LLC, which is a private mental health practice located in Alachua, Florida. She's also the founder of the Alachua County Perinatal Mental Health Coalition and co-founder of the Florida Maternal Mental Health Collaborative, which are both 501c3 nonprofits. Lauren's passion for serving families during the perinatal period came from personally experiencing postpartum depression at a time in Florida when no specialized services could be found. Lauren is a native Floridian, receiving a Bachelor of Sociology degree from the University of Florida and Master's of Social Work from Florida State University. Lauren has been in private practice for 5 years and most recently expanded services available to Florida families by founding Better Beginnings, where comprehensive mental health services, including the state's first perinatal partial hospitalization program, are available. Outside of her professional life, Lauren enjoys spending time with her husband and 2 sons. So thank you. Welcome, Lauren.
Thank you.
We're glad to have you, Lauren.
Thank you. I'm excited to be on the webinar today and just to talk about the local coalition and then statewide as well, what's happening in Florida in the way of maternal mental health.
Great. Thanks, Lauren. Well, we're going to start. We did get a little bit of background with your bio about what brought you to this space, maternal mental health, and we just want to stop and see if there's anything else that you wanted to add. We know that you had some personal experience. You were a clinician like so many on the phone today. Lauren, anything else? Because we know, those of us that do this work, we know that it's a significant commitment that you do this in a volunteer capacity. Anything else that you want to share about why you were drawn to this work and knew you had to do more?
Sure. For myself, as a licensed clinical social worker, it was pretty surprising to me that, learning about family systems and, foundations of community health, we just did not touch upon whatsoever mental health during the time of conception and pregnancy and post-delivery. And so, I think when I go and train and speak, and just have the opportunity to speak with other mental health professionals, the same is true really across the U.S. I think recently we have a few training programs specific to perinatal health of families beginning, but, finding the right kind of additional training, diving into the research and connecting with other professionals in this field has been really important for the care that I provide others.
Very good. We appreciate that. Well, we're going to jump in, Lauren, to hear a little bit more about your coalition. So we're going to advance the slide here. Everyone should be able to see my slide. So tell us, and I know I did not pronounce the county. It's Alachua County?
Oh, you got it. That's it.
I got it right that time. Tell us a little bit about the coalition and how you came to form the coalition.
Okay. So the Alachua County Perinatal Mental Health Coalition, we have yet to come up with a shorter name. I know eventually we probably will. But this started about 6 months after I opened my own private practice. And it was important to me, from a business sense, first of all, to connect with providers and organizations in the community to let them know, why I'm doing this specialization in perinatal mental health and connect, but also to raise overall awareness in the community and build momentum in the way of addressing this, community-wide. And so the first thing that we did, I did a film screening of Dark Side of the Full Moon from fellow Floridians Jennifer Stoneman and Maureen Fura. That has been shown all over the U.S. and outside of the U.S. now. Amazingly impactful film. And invited anyone in the community who would listen or take a flyer. And so we had a lot of providers and non-medical providers show up. So it ran the gamut from families to doulas, midwives, nurses from OBGYN and pediatric practices. And so we screened the film, and then we had a panel of various medical providers, those who had experienced perinatal mental illness, to be able to talk about the film and what is the next step, what's the action step in our community. And so from that discussion came the first very informal formation of the coalition. And we had monthly meetings and began to formalize over time. And about a year after that first meeting, we received our 501c3 nonprofit status. And so that was the beginning of that.
Great. That's helpful background. And we often share that it takes a simple action like bringing people together around a documentary screening to generate interest and excitement. Lauren, that sounds like exactly what you did. Tell us a little bit about who's involved in your coalition.
So over time, the numbers of memberships have grown, and so this includes our local child welfare professionals. It includes both of our major hospitals, various affiliation from our private HCA hospital and our teaching hospital here at the University of Florida, have engaged in meetings and in raising awareness. We have different mental health providers, midwifery, doulas, birth educators, women and families from the community. Our local school board has recently become more engaged, and other nonprofit agencies as well.
Great. That's helpful, Lauren. And I'm sure that you'd be willing to connect with some folks if anyone's interested in starting their own coalition. And 2020 Mom is also available to assist if you've got questions or just need support connecting with folks who've done this and run their own coalitions. You don't even have to be a nonprofit. You can find a backbone organization to do this work with you that is already either a nonprofit or sometimes county public health departments or mental health departments, et cetera, might be interested in partnering with you. So thank you, Lauren, for describing how this is working for you. Very exciting and important to know where your roots came from and how this legislation ultimately came to be. We're going to go ahead and go to the next slide. And you can see actually, Lauren touched on some of this, that the coalition was formed in 2015 and is a 501c3, so a charitable organization under tax code from both the federal and state perspective. Lauren, you touched on who is involved, what stakeholder groups. Did you want to talk about the board of directors or any advisors as well?
Sure. So we have a board of directors, and then we have some advisors. Some of our advisors include local OBGYNs who may not have had the amount of time to commit to regular board meetings, but certainly wanted to be involved, pediatricians as well, local researchers at the University of Florida. And then our board of directors includes psychiatry, at least one of the local hospitals, behavioral health representative. We have an attorney on the board. We have other survivors on the board as well.
Great. And for folks that are not familiar with nonprofit board requirement, so it's separate from the community coalition meetings that Lauren's been having, but likely some of the same overlapping clinical designations, et cetera, that are actually leading the organization as a member of the board of directors. Very good. Thank you, Lauren, for that. Let's now move into, Lauren, we're familiar with your work as a coalition doing a community needs assessment and creating a report. Let's now talk a little bit about that community assessment that you did. What was that process? And we can see up on the screen here that that work began in 2016, so a year after you formed. Talk to us a little bit about why a community assessment and what.
Sure.
Thank you.
Sure. So the board of directors and sort of the larger coalition membership meetings began to have conversations about, how do we know exactly what we're starting with in our community, because perinatal mental health, maternal mental health had never really been addressed in our community, although we have, wonderful community boards and organizations focused on families. But this specific part of family health had not been studied, and we really wanted to not place our own individual ideas on how to best serve our community into place, but we wanted to hear from the community and really learn about where the gaps were, what the needs were, what was already existing in order to move forward. And so there was an opportunity through 2020 Mom to engage in learning about how to go about assessing the community. And we were a little bit lucky because we already had stakeholders, or a good amount of stakeholders in place. And so I was thankful to at least have that part established, and then think about formalizing this process for a community needs assessment. And so what's really important about our needs assessment, like you said, it was just a year after establishing as a nonprofit. We had very little to no money in the bank, and so no funds raised yet. And so this was done solely off of volunteer hours, free labor. As I mentioned, we have University of Florida here, as well as some other smaller colleges and community colleges. And so we were able to receive some of that volunteer support through some public health and social work programs at University of Florida, and then at St. Leo University here in Gainesville. So that was a really helpful element of this assessment, as we knew we were all employed otherwise, and again, had no money to do this outside of volunteer hours.
Right.
So, yeah.
That's helpful,
So
Lauren. I'm gonna just pause, and I want people to really think about that piece of information, because what we have seen before, and I think what set your work apart, Lauren, is we see that there are folks so anxious to do things that they may actually outreach a legislator to share their story, and then in hopes of running some legislative action. But what you did here to stop and do it as an assessment, even if it was just one county in Florida, really, I think, is a critical piece of the advocacy action pathway, is to do such an assessment and issue a report, so that especially when these reports are created with multiple stakeholders, which we know your process included, that it lends itself to much more credibility and support when legislators have something to point to. So you touched on a little bit about some of the resources you had or didn't have, right, as a volunteer in doing this assessment and kind of running the coalition. Let me, if you all don't mind, let me just show my screen. And I am curious, folks are able to see my screen okay? You can use the question box and let us know if you're having any trouble seeing the screen. Okay, good. So folks can see the screen okay. Let me go to our website. I'm just going to show folks, Lauren mentioned that there was a resource available that 2020 Mom shared. And Lauren, I thought it would be helpful to point out to folks that this toolkit is now available on the 2020 Mom website for those of you that want to start coalitions and do a community needs assessment. Lauren was actually part of a pilot program and had a chance to do this earlier than available to the general public. So Lauren, let me show this resource just briefly, and then we'll get back to what the outcomes of your assessment were. So you'll see under resources and positions that we have the community action toolkit up here on my screen. Not a whole lot of text up here, introducing what the community action toolkit is, or community coalition toolkit is. But you can see you can download the toolkit for free. We debated whether we would charge for this, and we decided it should just be available for free. So feel free to take a look at that, everyone, and poke around. It's quite extensive, and we would love your feedback on whether you would prefer a skinny down version. But Lauren, as you can attest, you can word search, and there are hyperlinks to different resources. So if you've got time to really dig in, we think this resource will be quite helpful for you.
Oh yeah, a lot of great information. The wheel doesn't need to be reinvented.
Excellent, thank you. Great, so Lauren, talk to us a little bit about what your needs assessment included. So I think you may have done a survey of how many therapists or hospital programs existed, for example, that specialized in maternal mental health, anything that you can share with us. And again, these ideas are all in that toolkit, which we just showed you. But would you help us understand what kind of needs assessment did you do specifically?
Sure.
What data points were there? Yeah.
Sure. So, one of the first tasks was to find existing data. And, we had to sort of think in broader terms because, of course, this part of health and mental health, again, had not regularly been studied in Florida by any of our Department of Health or our wonderful universities in the state as well. So we did have the pregnancy risk assessment measure and scales that the PRAMs that are done annually. We had the Florida maternal infant child home visiting data report that they regularly will do. And we have Healthy Start coalitions here in Florida as well. And then, of course, census data and health department data. So we gather whatever information was already existing, which really wasn't a whole lot. And then we began planning out generating primary data. And who were we going to talk to gather information? And again, how are we going to do that given our lack of resources and our hope to complete and have a findings report within a little less than a year? So we sort of set ourselves up on a really very tight timeline to just sort of scratch the surface. And so I really feel like this first assessment, it's our phase one, and a little bit of a preview. We are beginning to kind of reconvene to have a report out by the end of 2020 as well, to take a look back and again move forward with what's next. So we spoke with yep, go ahead.
No, go ahead, Lauren. Thank you. You're going to lead into what primary data you collected. That's helpful.
Yep. So we had some focus groups with women and or partners to ask, sort of existing understanding of anything from just overall health during pregnancy and after delivery to what services they engaged in, any existing understanding or knowledge of mental health during this time period, what resources were most important to them, things that were helpful, weren't helpful, and some of their experiences as well. We spoke with we had some informed sort of expert interviews with medical providers, as well as surveying mental health providers who, one of the search methods we did was on Psychology Today, and we would put in a search term for during pregnancy or postpartum mental health, and who in our community had listed as a provider that they were serving that part of mental health, and began to ask questions about education and training and who they were, part of the population they were serving, and what they felt like was needed as far as providing those services as well. And so those were some of our local listening efforts, as well as utilizing the hospital survey that is in that toolkit from 2020 Mom. We surveyed our two major hospitals here. One is a teaching hospital at Shands, University of Florida, and the other is an HCA private hospital. And we were pleasantly surprised that they both filled the survey out. And so I, was kind of holding my breath for that, but we did get that filled out. And, I think what was really important was through this whole thing, of course, is building relationships and letting folks know ahead of time, we're not looking for you to have all the perfect answers. This is the first time that this area of health has been studied in this community. So none of us really have the perfect answers. We just want to know how to serve women and babies and families better and how we're doing.
Perfect.
Yep. And then we also surveyed as many OBGYN and pediatric providers as we could reach and as would respond as well. And overall, our numbers as far as surveying OBGYN and pediatrics was lower than we had hoped for. And again, this is phase one in my mind. Now, all of those stakeholders in our community know who we are, have read our report. We sent everyone a report, the findings report. And there's a lot more motivation to engage in educational training that we provide through the coalition on when to screen, how to screen, how to make that flow easy, and where to refer, because I think, most of us on this webinar have already heard that, medical providers in the community want to do a good job on screening and referring, but if they don't have confidence in where they're referring, sometimes that just doesn't even happen. So they're not even motivated to screen and sort of open up the potential liability sometimes of where to send this person.
That's right. Great. And it was really helpful. And if you can see the screen, those of you that are looking at the screen right now on the webinar, you can see that you can find the full report, which I want to go back through, Lauren. After hearing all of this, I'm excited to pull it down and just dig in again to see what were the findings, how many people responded. It just sounds like such a thorough job. So congrats on the report. We know that that's a big undertaking, and again, without much of a budget and a lot of volunteer hours. So again, great commitment. Tell us a little bit about, we see this executive summary, which I know it's showing up small on your screen, everyone. We're going to follow up with a bigger copy of the executive summary and another page here in the deck. We'll make sure that you get those in the email that goes out with the recording of today's session tomorrow. But you can, if you look very closely, get a sense of the executive summary, what's in the green boxes. Those are really powerful statements. It looks like you put a really nice report together, even if you just eyeball that executive summary. But talk to us a little bit about the 4 bullets that we see here on the screen to the left of the executive summary. What did you find here?
Sure. So our executive summary is 4 pages, and I'll make sure you have that so you can email that PDF out to whoever would like that. But in our findings report, there were some prevailing areas to be addressed, and that kept coming up as common themes. And so, it wasn't too big of a surprise for us that there was pretty low awareness about sort of what I call as a clinician, the spectrum of perinatal mental illnesses. And so the awareness was certainly an area just community-wide that needed to be addressed, in addition to stigma. From our local listening and focus groups, we had many, many, many women and partners say that, okay, if I knew how I was feeling and I wasn't feeling well, I was too afraid to even say anything about it to a medical provider for fear of, child welfare services being called, or being what we call in Florida Baker acted, psychiatric crisis hospitalization, if they said the wrong thing to the wrong person. And so, again, this then goes into the next bullet point on education for providers. And by providers here, we don't just mean OBGYNs and, midwives. We also mean mental health providers, building the capacity of psychiatry, psychology, licensed mental health providers, social workers. And in addition, for us here in this community, we really wanted to engage with our local child protection services, because what we understood is that fear of saying the wrong thing to the wrong person was sometimes attached to real instances of DCF getting involved when it appeared as though this mom was experiencing, let's just say, postpartum depression, and could result in many different things, from the children being removed to just many things that were not therapeutic to treat that mom. And so we really found a huge theme and need to educate our community and those providers, both just from the basis of what is a perinatal mental illness, to how do we detect it, how do we get the word out about risk factors for prevention methods, as well as screening, and of course, the most important, the right kind of treatment. We also found here in our county that approximately 30% of folks having babies or having, being within the first year postpartum are at or below 100% poverty line. And so that low socioeconomic status presented data for higher risk of experiencing perinatal mental illness. And we began to find some connections between that low socioeconomic status, higher risk, and stigma, and perhaps child welfare involvement and lack of mental health treatment. And then, of course, the last bullet point you see there is the right kind of support for parents. And so, we were lucky to have responses back from our written surveys, as well as focus groups with parents, saying that while different supports were offered, they felt as though they were being given directives instead of what they really needed, which was to understand and to hear from, an authority figure or a medical provider. This time in life can be really difficult, and many, complications for mental health can present themselves. And, here are supports that talk about, we know you're a good parent, and here are ways to take care of yourself while you're taking care of your child. And so really helping that parent, feel confident in parenting and being the expert on their own family health, as opposed to receiving directions and directives.
Great. So helpful, and what great key points that I think all of us will hear if we haven't yet done these kinds of assessments in our communities, or others haven't, be able to identify in our own communities. So really great point. So let's move on, Lauren, to talk a little bit about what happened next. So you did this great assessment and documented all the findings in a report and an executive summary. and ended up sharing it with a couple of legislators. So the next slide that we have up on the screen is a fact sheet, but walk us about the bill that was introduced, but walk us, before we dig into the bill, walk us into what happened next.
Sure. So we knew, because from everything we could find, again, no one in Florida had done a specific study, community needs assessment, on maternal or perinatal mental health. And so we knew that we wanted to gain the attention of decision makers, both locally and statewide. And so, as you mentioned, we were able to get some email addresses for both local government officials, elected officials, as well as our state representatives from both here in Alachua County and then around the state. And so it was, really neat in the middle of the night to receive a phone call at 10:30 from a phone number in Miami. So I'm up in North Central Florida. This call was coming in from Miami area. I didn't answer it. I should have been asleep already anyway, so I didn't answer it. Let it go to voicemail, and in the morning, listened to the voicemail, and it was Senator Lauren Book from Broward County. She was a freshman senator. And she said, I'm sitting here feeding my twins. She has twin babies. And I'm in tears because I experienced postpartum depression. And this is so important, and we have to do something about it. And so, many phone calls and visits to Tallahassee later with her and her team through the Florida Maternal Mental Health Collaborative, and of course my relationship from the Alachua County Perinatal Mental Health Coalition. We were able to work with her to advise on drafting Florida's first legislation on perinatal mental health. And so, as you can see on your screen, it's the Florida Families First Act, and this was for the 2018 legislation last year. And it was introduced through the Senate first, Senator Book. And the initial submission and wording included those key points that you can see there for Senate Bill 138. And so it addressed awareness through public service announcements. It suggested that we have two hotlines, one for consumers to call in and one for providers, much like the psychiatric consultation line of McPap for Moms program up in Massachusetts, and then now, of course, the one through Postpartum Support International. Language, of course, in writing legislation is really critical and important, and so it encouraged providers to seek continuing education in the field of perinatal mental health. It also, once the initial legislation addressed establishing a statewide clearinghouse of mental health providers who were vetted to have received additional specialized training in mental health. And then it would require hospitals and birth centers. In Florida, there's a distinction between the two to screen, of course, at the postpartum visit and give educational materials and hotline information. And so we held an advocacy day in Tallahassee. We had advocates from all over the state that are connected to the Florida Maternal Mental Health Collaborative, visit their local legislators, make phone calls, write letters, and then come to Tallahassee for different committee meetings that took place in 2008. And we had a lot of interest and a lot of approval as it moved through the Senate and then over to the House. And then there was a tragedy in South Florida at Marjorie Stoneman Douglas High School, which is where Senator Book is from. And so certainly, and deservedly so, a lot of attention her attention went to that tragedy. And what we ended up with is on the next slide. she initially wanted to put all of the things in the Senate bill, and she did a great job doing it. And then what ended up being passed is the House version, House Bill number 937 of 2018. And so while it was certainly dwindled down to much less than we had hoped for, again, this was an excellent first step. A lot of testimony was given to different committees, and the issue was raised, right, where it had never really been raised before. And so what we ended up with is that the bill requires the Florida Department of Health to offer information and local resources by way of this existing toll-free family health line. And so the Florida Maternal Mental Health Collaborative, I'm a co-founder, and Dr. Heather Flynn up at Florida State University is a co-founder as well. We were able to work with the Florida Department of Health to advise them on what kind of education and training the counselors from the Family Health Line needed to receive in order to help someone or their family member calling in with concerns. It also revised already existing state law and requirements that birth centers, and again, these are freestanding birth centers in Florida, needed to include in their postpartum evaluation screening and information on perinatal mental illnesses, and again, to direct them to the toll-free family health line and the statewide resources. And so the appropriations that ended up being attached to this, initially it was requested right around $1 million, and what ended up happening or being approved was 100, as you see there, a little over 104,000 recurring funds towards the family health line, excuse me, and then 21,600 non-recurring funds. And so ongoing, the Florida Maternal Mental Health Collaborative is partnering with the Department of Health on this, and the Florida Maternal Mental Health Collaborative maintains a statewide resource list of those providers that this toll-free hotline is referring to. And we also partner with the Florida chapter of Postpartum Support International as well to make sure that we have an ongoing and accurate list of those folks.
Well, bravo. I'm sure folks have some questions. I just also want to acknowledge and make sure folks understand that, Lauren, what you accomplished, though it wasn't exactly what you intended to accomplish, right? It's sort of welcome to the sausage making process. You'll hear that term if you get involved in legislative advocacy work. And of course, the school shooting in Florida, of course, as you said, and rightfully so, interfered perhaps with making this as much of a priority as the senator that you're working with had wanted to make it. But really incredible that something did pass, because that's a real triumph in and of itself to have something pass, and that it really is something that's going to make a difference, Lauren. So just want to say bravo on behalf of 2020 Mom and also all of our listeners who I think would echo my sentiment. One of the things, we're going to actually open it up to questions. So feel free, those of you on the line, to use that question feature to ask some questions. One of the things I'd love for you to go back to, Lauren, is once you created the report from the county coalition that included that state level data and county specific data, how did you get it to the legislature? How did she happen to get her hands on it and read it so late, in the night, and need to call you and talk about being in tears? What was that step? What did that involve?
Well, that involved just some good old-fashioned research and phone calls on getting email addresses so that we could send this out. Certainly, we also did some local press releases and sent it out, disseminated through our different networks through the Florida Maternal Mental Health Collaborative from different university systems, Department of Health, March of Dimes. But she was one that I had personally emailed, a little bit of research, who is on, who of these senators are on health committees. And she was a chair of one. She still is a chair. returning this session. And so prioritizing which senators to send it to also included learning more about them and what committees in the state they served on. And then lo and behold, it was something that was prioritized from her staff, thankfully. And I think, as anyone would learn more about Senator Book, she's a very genuine person, and I think is really serious about what she is doing for the state as a representative. And so she took the time to read it, and it struck a chord with her because she had a personal experience. And so certainly that was the most powerful thing in launching forward the impetus for this legislation.
Very good. Thank you for that. And again, another testament to all the work that you put into this, and that personal email to her really made a difference. And we sometimes might think, oh gosh, we got through the hard part, but there's a lot of really critical steps, right? Stars need to align, and it just happened to be that she was the chair of a committee and suffered herself and was perhaps still juggling the very difficult days of early parenting. So thank you, Lauren. That's fantastic.
I think if I can mention, yeah, absolutely. Yeah. I think one of the other things that we, you'll see there on the first page of our executive summary as well, and that we tried to highlight was, the approximation of how many dollars are potentially being lost or spent by not treating perinatal mood disorders. And so, we also did some research on the numbers of births in Florida combined with a study out of Minnesota, I believe, on the, two generational costs of, perhaps mom engaging in psychiatric services, hospitalizations, and that child also over time requiring more medical services as well. And so being able to say, look, this is how much it's costing us, and here's why it costs us that much, as opposed to taking preventative measures, I think was really important to highlight as well when trying to gain the attention of legislators.
Yes, that's such an important point. And folks, you can see on the screen here what we're circling. Lauren, I do think that we have some of those research studies, the Wilder Institute report, and a couple others in the Community Action Toolkit. And to the extent there were other metrics or studies you were able to lean on, we'd love to be able to share those with folks later. But it's such an important point. It has to be rooted in, these arguments have to be rooted to succeed, right? Have to be rooted in some sort of evidence base and studies. So it's a really important point. Lauren, what else do you want to leave folks with as we wait for other questions to roll in here? And then I'm going to ask our attendees, if you don't have a question, we want to know what resonated most with what you heard today. So put that in the question feature box. What resonated most? Was there an aha moment, or is there something that you're feeling empowered around in terms of the next step that you can take? Let us know in the question feature. But Lauren, as we conclude and wait for questions and comments to come in, any other key piece of information you want to share or advice that you want to share with folks?
Well, I think being in it for the long haul is really important. Naturally, I think I can be impatient. And so, understanding who your stakeholders are and the amount of time that it will, take to undertake an assessment of your community is really important to think about ahead of time. I think another piece that's really important is, empowering those stakeholders once they're identified and once they want to be engaged in addressing perinatal mental health is to engage them in a way that has their buy-in, whether they're a fiscal sponsor, like you mentioned earlier, for the 501c3, or whether they are identified as, being a training provider, or access to be able to, do studies in the community. having those stakeholders take ownership for a specific piece is really important as well, because it keeps them engaged. So many issues pop up from one day to the next that keeping them engaged means that you have to, have specific buy-in in a real tangible way.
Oh, that's fantastic. And I'm looking at one of the questions that came in as you were speaking, how critical it is to involve multiple stakeholders so that it's not just one organization or even one person's idea, right, or work effort, but multiple stakeholders and creating buy-in. One of the questions that came in, and first off, I have to say there are a few health plans, or at least two, I should say, maybe not a few, at least two health insurers on the line today, and bravo to you. I'm using that word a lot today. Very exciting. One of the questions that came in now is from another health plan in Florida. We know there's one from California on today too. And that health plan is actually doing some training around maternal mental health. So we'd love for you to actually connect with Lauren if you haven't done that yet, who can help look at the training and provide insight around the content if that's helpful. We do know sometimes well-intended training developers will create training that doesn't cover all of what we all believe in this field should be critical components. So feel free to connect with Lauren. But another great question is that training, there hasn't been a lot of interest from the provider community. And so, one of the things that came to my mind is, are you working with a trade association? So we know there's a regional, sometimes a state-specific chapter, in quotes, of the American College of Obstetrics and Gynecology, or the American Academy of Pediatrics, for example. We also know that many psychiatrists are afraid to address this population and send women back to their OBs, who send them back to their psychiatrists, right? To psychiatrists, your American Psychiatric Association chapter in your state, they have state-specific chapters, are great partners to talk about, that this training is available, I'm guessing, free of charge to all of your network providers, which may be in your medical network and your behavioral health network. So that's fantastic. But Lauren, any other advice you have around training and getting providers engaged in training?
Right. So in Florida, in late summer, early fall this year will actually be our 4th annual Florida Perinatal Mental Health Conference. And so we offer continuing education credits. Again, this year we will offer continuing medical education credits at that conference. And we, at that conference, draw, the attention and attendance from researchers to nonprofit and private organizations, and as well as medical providers, just talk about all different elements of training. I think one of the things for medical providers in particular is that it needs to be convenient and there need to be continuing education credits attached to that, right? So you have to figure out what's the right kind of incentive to engage medical providers. I think what's also been really important is to be able to have the research for them and sort of packets of information, if you will, on what tools they will need. And sometimes it's as basic as, how do I open the conversation with this mom in my office? So even just training at the very basic level of normalizing the conversation, we've gotten some good feedback that is really important. In addition to, how do I, do I bill for this? How do I bill for this? How often do we follow up? And again, the most critical element of what are the resources in my area that have additional training so that I don't send my patient somewhere that they won't get a response, or they'll have to wait a month, or they'll be worse off than when they began. So I think all of those elements are really important.
And actually really exciting that a health plan's asking. And two of the things that I heard you say really tie into areas of influence and control by health plans. And that is sort of this, what do I do after I have a positive screen? So that can be part of your training. And to the extent that the health plans on the line or those on the line that work with health plans or are interested in connecting with health plans that you're involved in, you can ask about care coordination or case management programs. Several, I think the Inland Empire Health Plan that's on the phone from California is actually doing this and providing care coordination services. So once an OBGYN, for example, identifies a pregnant woman as having depression and wants to get her into treatment right away, the fact that the provider networks are often separate is a significant barrier, right? Just not close to the medical networks or the people in their building or down the hall or down the street that they know well in the medical community. It can be a great service to provide care coordination and assist that OB and the patient in finding an in-network provider who has capacity, who's been trained in maternal mental health to provide those services. And then spot on about the billing directions. Health plans, that's what sits with you too. How do we bill and get paid for our time, including screening if available, particularly for OBGYNs when there's a case rate for the full pregnancy and postpartum, a flat capitation rate versus billable slot generally of time. And so great question. Thank you so much for asking that question and allowing us to share. I don't think we have any other questions coming in, but you can see here on our screen that we have Lauren's email up. I also will let folks know that my email address is joy@2020mom.org. It's not up on the screen, joy@2020mom.org. Lauren is up here on the screen. And we'll again follow up with the recording from today's session. We want to encourage you to keep the conversation going. For those of you who are interested in advocacy, we will soon be launching an advocacy learning network where you can come together with great folks like Lauren and ask questions about, this is where we're stuck, or we're concerned about this in the appropriations committee hearing, for example. Did anyone have experiences or advice? So a way that we can all connect and lift each other up and learn from each other. So if you're not yet subscribed to the 2020 Mom e-newsletter, get subscribed so you can be a part of learning when that resource becomes available. Lauren, thank you so much for your leadership in the state. You are setting the pathway for other states to take note. And we're just so grateful for your time, and congratulations again on becoming the honorable mention in the Innovation Awards for Maternal Mental Health.
Thank you. Such a great opportunity to be able to talk about this. It's a marathon, not a sprint, right? So to talk about our path in Florida to addressing perinatal mental illness. And we're thankful also for the resources provided by 2020 Mom as we've gone through this process.
Great, Lauren. Well, thank you again so much. And all, we hope to stay in touch. The recording will be coming out tomorrow. Thank you, everybody.